welcome to the Alabama Public Health Training Network. I'm Brandon Vaughn with the Alabama Department of Public Health. Thank you for joining us for our program today, Introduction to Tele-Behavioral Health. If you have a question about anything being discussed today, please email or call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts and evaluation are available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for this program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, CE credit will only be awarded for 2 years for nurses and social workers, expiring on October 30th, 2021. If you're watching this program on demand and want to receive a social work CE certificate, you will need to complete the social work test and send it in, along with your sign-in sheet and evaluation. If you're watching this program live, there is no social work test required. For social workers, if you're watching this program live, it qualifies for classroom hours. If you are watching on demand, it is considered non-classroom hours. Before we get started, I would like to introduce our presenter today. Elena M. Parker Merriweather, Director of Behavioral Health for Montgomery, Medical Advocacy and Outreach's Copeland Care Clinic. Welcome, Elena. I know you have a lot of important information to cover today, so let's go ahead and get started with your presentation.
Thank you, Brandon. I appreciate the opportunity to come out and share information on telebehavioral health. It's always good to be able to come back and share new information and see old faces, so I appreciate your introduction. So with our topic this morning, Introduction to Telebehavioral Health, I just want to briefly go over the objectives that we will cover throughout the course of the discussion. We will provide a general overview of the competencies associated with telebehavioral health services, also discuss basic terminology used in the culture of behavioral health, as well as talk a little bit about the administrative, technological, and programmatic considerations when it comes to developing a telebehavioral health program. So we first want to start off just by talking about why telebehavioral health? Why is that important? Well, if we just kind of reflect back in the news over the last several years and different things that have occurred in healthcare as it relates to access, there are a number of different reasons that telebehavioral health, as well as just telehealth services overall, have evolved over the last several years. So if we look at the first one that we have listed, hospital closings in rural communities. Well, several years ago, there were several rural hospitals and smaller hospitals in different parts of the state that closed due to a lack of financial resources as well as other resources as well. In addition to that, we look at the mental health disparity, which is one of the 6 disparities that impact minority communities in Alabama. And when we look at some of those mental health disparities that are impacting minority communities, but also those that live in rural parts of the state, there has been a lack of access to resources regarding transportation, but also due to the fact that there are several mental health facilities that have actually closed down or that have merged with other medical facilities. So there's been a correlation between hospital closings as well as mental health facilities as well as mental health hospitals that have closed throughout the state as well. So when we look at the correlation between the two, we have to begin to think about and plan on how we can actually serve individuals that have behavioral health issues, with consideration to the mental health disparity being one of those behavioral health issues. In addition to that, limited access to transportation is a barrier to care for a number of different health disparities. And what we have posted is a map which shows a little bit about how those disparities have impacted access to care in Alabama. So what we see with the map is that only 5 of Alabama's 67 counties actually have full-time public transportation. So when we look at that, we also have to consider that transportation assistance is also limited for people who are in need of different types of medical care, but also mental health and behavioral health services as well. And when we look at transportation assistance and the limited availability, we also have to consider individuals that may or may not own a personal vehicle. but also individuals that have to rely on family members or friends or church members to take them back and forth to different types of medical appointments. And with the recent evolution of other transportation means such as Uber and Lyft, they are not as available in some of the different rural counties. So when you look at limited access, it significantly impacts an individual's capacity to be able to access behavioral health services. So transportation is a key issue that is constantly being researched, and I know resources are often solicited to be able to address that barrier. So we also have to consider the HPSA component, health professional shortages area. And so when we look at HPSA, now this is data that was available in 2015, and there might be some additional updated data available. But when we look at HPSAs, we look at the shortages of behavioral health professionals in rural counties that can treat people that have behavioral health issues. Now, when we look at health professionals, we look at both clinical providers, but also non-clinical providers. And so when we look at those providers that may or may not be available in some of the different rural communities, we look at disciplines that treat people that have behavioral health issues, such as psychiatrists or psychologists, psychiatric nurse practitioners, licensed therapists, licensed social workers. But in addition to that, our community outreach workers, community health educators, linkage specialists, as well as healthcare navigators also fall under the category of non-clinical healthcare providers. And so because there is a shortage of clinical and non-clinical healthcare providers in the community, there's some barriers with people being able to access those services, especially if they have been diagnosed with some type of behavioral health issue. So when we consider other challenges that people in the community are facing, one that we often hear about in the news, and it is continuing to evolve over time, is high rates of uninsured people in rural communities. But also when we look at those high rates of uninsured people, we also look at coverage as well, resources and services, and the availability of those services to be able to cover people that do not have insurance and have been diagnosed with different types of behavioral health issues. Another one that we also have to consider is the concept of stigma and perceptions about behavioral health. There's been a lot on the news, and we often hear about ongoing discussions pertaining to perceptions about people that have been diagnosed with substance use disorders, but also perceptions associated with people that have mental health disorders as well. And when you add on to the fact that you have several of these individuals who are living in rural communities, it has an impact as well. So we look at the stigma component and the perceptions of people who are living with substance use and mental health disorders, but also in addition to that, people who actually care for them and provide services. And so we focus on stigma and perceptions in our natural network. And when we talk about our natural network, we look at, for example, the workplace that we in. How do our coworkers view substance use and mental illness? We look at our family structure, okay? And when we look at that family structure, the family structure is primarily based on how that individual chooses to define their immediate family, because now what we see is that the traditional family description has actually shifted, okay? So we look at how that individual defines or identifies who and what they consider to actually be family. And then we look at the school system, okay, because now we're seeing quite a few situations and issues pertaining to children who have been children as well as adolescents, teenagers, and young adults that have been impacted by different types of substance use behaviors, but also with consideration to bullying that is receiving a lot of attention. And then going back to the vaping and the juuling issue as well, students are encountering quite a few different issues as well, where they're having to access support and receive assistance. So when we look at that, we look at the stigma that is associated with that and the fear of asking for help, because sometimes people don't know what type of response they're going to get. And a lot of that is often associated with stigma as well as perceptions. And then the other challenge that we want to just kind of mention, and we'll talk a little bit more about as we proceed through the discussion, is access to technology and bandwidth capabilities, which can sometimes be very, very limited in rural parts of the state. And so we talk about the limitations associated with it, but we also have to look at the availability associated with that as well. And so that kind of varies from community to community, in addition to the resources that are available to support the technological needs when we talk about telebehavioral health. So when we look at the different challenges, we have to consider the solutions. And I really, really like this slide because it's in the middle of nowhere. And because it's in the middle of nowhere, you can't really tell what's near, okay? And so I wanted to just put that up there to give a good visual of what we mean when we say rural communities. So when we move forward into some of the possible solutions, we look at the evolution. And I will say probably over the last 10 years, maybe, there has been an evolution of teleservices. And I specifically categorized it as teleservices because different disciplines are researching and getting more information about how they can begin to deliver services through different types of distance medians, okay? And so I just listed a few because I think all of us can in some way relate to some of these, or have heard about it, or have been a part of some discussions about teleservices. So one that is very, very common that we often hear about is telehealth or telemedicine. And it is very discipline specific. And the reason we say it's very discipline specific because when you look at clinical providers, but also non-clinical providers, it pretty much determines what they deliver through telemethods, okay? So we also have the component of telepsychiatry, which is very specific and is pretty clear as to which discipline that is associated and affiliated with. But we also look at telehealth, which is being integrated into numerous public health settings, but also primary care settings. And we're seeing that there are some specialty care settings that telehealth is being integrated in as well. And then we look at the telepharmacy component, which is very specific to pharmacists who are providing services to individuals that are living in rural communities as well. So we're going to transition and talk a little bit more about telebehavioral health and what that actually encompasses. So just for the purposes of making sure that everybody has a good, clear definition, we want to first address what telehealth really is, and then we'll talk a little bit about telebehavioral health. And this is a textbook definition, so I wanted to share something that I think everybody could potentially relate to. So when we look at telehealth, it is used by healthcare professionals to include clinical as well as non-clinical healthcare providers to deliver healthcare services at a distance via telecommunication technologies, okay? We look at telehealth as it includes a growing variety of different types of applications and services using a two-way system. That two-way system could include video, email, wireless tools, as well as other forms of telecommunications technology. So it varies based on what type of technology or device is actually going to be used. We also look at how telehealth is not considered to be a separate medical specialty, and that's something that often has to be emphasized. It's not a specialty. It is simply considered to be a delivery tool or a system that is used by a provider to deliver a distance service. Okay. So let's look at telebehavioral health. So as I proceed to talk more about telebehavioral health, I want to just kind of mention that potentially use certain terms interchangeably, but I want to encourage you to think about whatever population you serve. Who are the actual constituents that you serve? And so when we look at the different constituents, you know, in some venues you might actually serve patients. In other venues it might be a client. In other venues it might actually be considered a recipient or a participant. Okay, so they're actually all the same thing. They're all our constituents, but think about it from the perspective of who you actually serve within your workplace. So when we look at telebehavioral health, primarily what we're looking at is the remote delivery of behavioral health services. So this can actually include substance use. It could include mental health services. It could include screenings, assessments, consultations over some type of telecommunication infrastructure. Okay, so primarily what the system does, it allows for the provider to actually evaluate, diagnose, and treat constituents without the need for an in-person visit. Okay, so that's what we look at when we talk about telebehavioral health. It is very patient, constituent oriented, but also specific to the person who's actually providing the service. So another population that we also have to consider when we talk about telebehavioral health services are people that actually have functional and access needs, okay? And when we talk about people that have functional and access needs, we talk about people that might actually have different types of sensory challenges, people that might have mobility issues, people that have difficulties with accessing resources through traditional means because of those different sensory issues or issues pertaining to mobility. So when we talk about reaching out and being able to provide telebehavioral health services, we look at not just the service, but also the individuals that might have some barriers or some challenges in being able to receive and access those services. Okay, so the next thing that we want to look at is telebehavioral health for you? Is it a fit for you and as well as your organization? Why do we say that? Because it's not for everybody. And I think it's very important that we as providers, clinical and non-clinical providers, do a self-assessment and ask yourself, is this something that I can actually do? Is this something that I'm actually capable of? And is this something that actually fits within the scope of services and programs that are offered by the organization? So one way we actually assess this is by looking at different types of telebehavioral health competencies, okay? And so one thing I want to mention before we move forward is that this is intended to kind of get you to think a little bit more about whether or not this is something that you're interested in and if it's something that you're capable of doing. And all of it is something that you can be trained on, okay? But you want to do a self-assessment to identify what your comfort level is in providing telebehavioral health services. So when we look at the different competencies, and there are quite a few of them, we have to remember and stay connected and in tune with our primary goal. And when we look at that primary goal, our overall goal as servants in the community is to help people, okay? To help people, to help patients, to help clients, to help participants, to help our constituents. And one way that we help them is by meeting them exactly where they are and empowering them to thrive and grow. So I want to emphasize the concept of we meet them where they are, okay? And oftentimes that is addressed from multiple different perspectives. And so I want to talk a little bit about those different perspectives. So in meeting people where they are, it's not just meeting them in that physical space, okay? It's not just meeting them in a particular geographic location or a particular venue. when we look at behavioral health, because it is very specific to behavioral change, behavioral modification, and looking at what needs to be done differently in order to generate new outcomes, we look at how we can, as providers, meet our constituents mentally. Where are they mentally in their process? How do we meet them where they are emotionally in their process? How do we connect with them in socially appropriate ways where they are? And also you have individuals that we have to kind of look at how we connect with them on a spiritual level. Okay, and so it varies from person to person. So when we talk about meeting people where they are, that concept expands beyond just the physical place. Okay, we have to look at the mental, emotional, social, as well as the spiritual concept that goes along with that as well. And when we look at the piece where we talk about empowering them to thrive and grow, we sometimes have to look at that common ground and identify what we can both relate to and identify that person's strengths in order to be able to pull that out and turn it around on them to help them to know what they can use to grow and get to the next level. So all of that fits into how we can help our clients to grow and thrive. So another competency that we have to consider is how we can support the behavioral health profession by implementing evidence-based practices. We all hear a lot about evidence-based concepts, evidence-based practices. You know, has this been tested and proven and known to be effective? But how do we integrate those practices into service delivery? But in addition to that, how do we maintain our clinical professionalism? And when we say clinical professionalism, that is oftentimes identified based on the agency who's providing the services, but it's also based on the discipline of the provider who's providing the service as well. So clinical professionalism can be identified in multiple different respects, and it's all based on how that particular agency identifies it and what the work ethic is of the individual who is providing the service, especially when it comes to addressing behavioral issues. But I think the other piece that is also important that is worth the discussion is being compliant with the law, because there are laws out there around telebehavioral health services and providing services through distance methods. And there are a lot of different things that individuals have to be conscientious of so that they can be compliant. And I know in a future presentation we'll talk a little bit more about those ethical and legal issues as well, so that everyone can maintain compliance. Okay. Other competencies that we have to consider. Learn how to choose the medium of telebehavioral health services that actually works best. And when we look at choosing the particular medium, we have to consider what's going to work best for the needs of the person that we're working with. Okay? It's a double consideration in that we have to look at what works best for the provider, and whatever works best for the provider also has to work best for the person that we're serving. Okay, so it's a couple of different things that we have to consider with that when we're choosing a particular medium. Another thing is, which is very important, is having a very thorough and full understanding of HIPAA, and what that actually means and what has to be considered when it comes to delivering telebehavioral health services, all of the legal and ethical issues that go along with that, and how it can be used effectively when delivering teletherapy services, and the importance of being compliant with that. We also have to learn how to protect client information on all types of electronic equipment during the telebehavioral health encounter. Okay, so there are a lot of different technological considerations, which I'll mention shortly, that have to be considered. We also look at how can we actually integrate what happens in session to what happens out of the session. Okay, so whatever it is that we're assisting our constituent with within a therapeutic session, how does that translate over, okay? How do we assist them in utilizing that information when they're not in therapy? So that's another competency that we have to look at and consider, because we're not face-to-face, okay? And we want to make sure that the person that we're working with actually understands those different concepts and how they can actually utilize it. So we look at the blending component, component of utilizing what's learned in session and applying it to day-to-day life. So a couple of different types of telebehavioral health encounters and who's usually involved with this process. So when we look at the different types of telebehavioral health encounters, the first one that we can talk a little bit about is home-based therapy. And when we look at home-based therapy, primarily what occurs is that it actually allows for the patient, the client, the constituent, whomever, that has behavioral health problems to receive consultations as well as psychotherapy in their homes through the use of secure technology equipment. Okay, so it's the provider providing services to an individual inside of their home with the use of technology. We also look at interactive telebehavioral health, which allows for healthcare providers and patients to communicate in real time. Okay, so that's something else that's important to consider, because that real time allows for interaction and communication without delays. And one that I think everyone has kind of heard a little bit about over the last several years, and it's very common, is encounters that occur in a community agency setting. It might occur in a correctional institution, a military installation, and we've already talked a little bit about rural clinics and hospital settings. So I'll give a couple of examples. So when we look at, for example, someone who is detained in a correctional setting, it could be a jail, it could be a prison, or it could be some other type of detention center, that individual might have the opportunity to receive services from a telebehavioral health provider through distance methods. Okay, there are often situations where psychiatrists, psychologists, behavioral health providers provide services to the institution out of the comfort of their own home, or they might be in a community setting and they're working directly with the person who is actually incarcerated. One that is very familiar for me is providing services at a military installation. Okay, so you might have a therapist that is in one venue in one state, and because military individuals move around quite a bit and are considered to be transient because of their jobs, they often want to maintain the same therapists. They want to maintain the same telebehavioral health provider. So even when they get stationed to different locations, stateside as well as in other parts of the country, telebehavioral health allows that individual the opportunity to continue to work with their therapist. Okay, so just kind of wanted to give a couple of examples around how that piece actually works, and show a few venues that those services are delivered in. So a couple of other things we want to look at is what we consider to be different terminologies, different types of terminology. And the first one is the hub clinical site. And this is just an example to kind of get you to think more about how this is actually done. So when we look at a hub clinical site, we look at when you're in a predominantly urban telehealth setting where one healthcare provider is seeing the patient or the client at a distance while consulting with a collaborating provider on site. So what that means is that you might have a psychiatrist who is providing services to an individual in a remote location, but in addition to that person who's receiving the services there, that physician is also working with and collaborating with a nurse who's there with the patient or the client as well. So that is a collaborative provider encounter or visit. We also look at the satellite clinic component, which is done predominantly in a predominantly rural telehealth site where the patient or the client interacts with the healthcare provider at a hub clinic site. Okay, so that's just another component to consider. So when we look at who's involved who's involved. In addition to the direct service provider as well as the indirect service provider, you might have a position such as the Tele-Behavioral Health support specialist, okay? And that support specialist is that staff member that is actually on site. Most times they're with the client or the patient, and they coordinate certain tasks to ensure that everything goes the way it's supposed to go. So they might assist with facilitating the equipment, making sure everything is connected, ensuring privacy, making sure security measures are in place, and also they might be utilized to complete any type of screening documents that might need to be completed as well. So this is just one of those, this is a support position that is very, very important and an integral part of ensuring that the service is going the way that it's supposed to go. So we also have to look at different types of medians, okay? And when we look at different types of medians, therefore at this point but you know, we might have more to evolve with consideration to technology. And these are a few that I think all of us can relate to: having a desktop, laptop, tablet, as well as a cell phone. These are considered to be the different medians. So in addition to that, we look at the medians, but we also have to look at the modalities, because there's a difference between the two, and I think oftentimes the terms are used interchangeably. So we talked about the medians, now we're going to look at the different modalities. So when we look at the modalities, we look at how telebehavioral health could potentially be provided through the use of email or through the use of video conferencing, through chat rooms, having a navigator or a consultant to facilitate the process. But I want to just kind of mention, we have to be really conscientious when we're dealing with chat rooms to make sure that we're talking to who we're supposed to be talking to. So there are different security measures that need to be taken into consideration before getting into a chat therapy conversation. That is not something that is often encouraged, but it is done. But we wanted to just mention it because there are people that do participate in chat therapy rooms. We talked a little bit about the navigator as well as the consultant, but also you have self-help information lines, and I included the image of one that I've actually had to utilize often and refer people that I work with, and that's the 24/7 helpline. It's the addiction helpline, and an example of how that addiction helpline actually works. It's a 24-hour helpline where people that have behavioral health issues can call if they need assistance. And the backside of that is the helpline is actually staffed with trained individuals who are knowledgeable of the disease of addiction and how to navigate individuals into a treatment program, okay? And so the difference in some of the other helplines is that when we talk about behavioral health helplines, they are actually staffed with trained providers who are volunteers. Sometimes they're volunteers, sometimes they're paid staff. But that's an example of a self-help information line, and it is another method that's actually used as well. So we're going to talk very briefly about technology and just some considerations that people need to think about if they're considering putting together a telebehavioral health program. And so this slide is just a picture of a unit that consists of 4 different pieces. And you'll notice you have the screen, of course, which fits on top of a desk, but you also have a camera, and you see 2 images of the camera. You see a single image of the camera, but also you see the camera that is mounted at the top of the screen. And then you also have what we call the convene unit, and back in the day that used to be a central CPU unit, the central processing unit, that was a part of some of the larger computers from several years ago, and then the remote control that's used to actually navigate the equipment. So this is just some simplistic equipment that providers often used when they're providing services from their office. It could be their business office or their personal office. But this is just an example of that, and just wanted to give everyone a visual. So this is considered to be the unit that's used in the delivery of some of those services. Just an example of that. There are others, but this is just an example for the purposes of this discussion. We also look at, as it relates to the different considerations, I want to just very briefly mention all of these. When it comes to planning, you want to make sure you have an IT person present on the team who can speak to some of these different components. So when we look at the different considerations, we look at HIPAA, privacy and security, which we mentioned earlier. We talk a little bit about encryption, which protects the privacy of the information during transmission. Now, when we look at the encryption piece, we look at manual information, paper information, but we also look at when it is transmitted electronically, okay? And so it's interesting to learn how an actual telebehavioral health room can be encrypted with consideration to the different equipment that's actually used. Another thing is looking at bandwidth, because bandwidth can actually impact the speed, the quality, the resolution, and the visual acuity of the encounter. Okay, so that's what we mean when we talk about bandwidth. We also have to look at firewalls, which is used to actually protect outside external sources from actually getting into our computer equipment, but also the different venues where we're actually providing the electronic opportunities for distance learning. And then you have the camera as well as the microphone, issues relevant to computer security, all of which are very, very important. And then the very last one, which I think is also worth a lot of discussion in the planning process, is making sure that you have equipment that works properly, that has been tested far in advance before the encounter is about to take place. But you want to think about user error as well. Okay, so you have technological issues that occur, but you also have user errors where people just may not know what they're doing, and it is what it is. But in looking at user error, that's where the importance of training comes in, and receiving technical assistance as well. So a couple of different considerations we want to just kind of run through. We have to look at the service needs of our constituents, and if this is something that can be offered to the people that we work with. We have to look at the agency's capability as well as their infrastructure to provide the different services. We look at staff training as well as the competency level, especially when it comes to the different competencies that we listed. And then we also look at the outreach capacity. Do we have the availability to market the program but also generate community engagement as well? We look at performance monitoring to make sure that everything is flowing the way that it needs to be flowing, monitoring, managing, and making improvements when necessary. All of this fits directly into the program planning and the development component, but also we have to look at the special program needs and how it can be adapted. So wanted to include this map. I don't know how clear it is from everyone else's view, but when we look at the map, this just kind of shows the MAO coverage area and how we have actually been able to reach out and work with different organizations in the community, such as Public Health and several others, to launch telehealth services, but also integrating the telebehavioral health piece as well. And so primarily what it shows is it shows where our telehealth resource center is actually located, and that is the location where we actually navigate, coordinate, and facilitate all the telehealth services, but it also shows the hub sites, the clinic sites, as well as other clinic access sites as well. So when we look at programming, what we do and what's actually available, we look at the behavioral health integration piece and what we can do through this distance method. So we look at screenings and assessments, We also look at how we can do initial intakes with our constituents, providing comprehensive as well as individualized services, consultations, psychotherapy, which can be either individual or group, interactive trainings, but also clinical case staffings, as well as treatment team meetings as well. So this has been shared within the context of the behavioral health culture and services that are delivered as it relates to substance abuse, as well as people that have mental health issues. Couple of provider considerations that we want to look at. So when we talk about providers, we talked a little bit about the different disciplines that might be delivering services. So you want to look at this not just from the perspective of a medical provider, but also a licensed behavioral health provider or someone who is in practice to become licensed. So it could be a therapist, it could be a social worker, it could be a nurse that works in behavioral health as well. So what is the role? What is the role of the telebehavioral health provider? To screen individuals who are seeking services to determine if they are appropriate to receive services through distance methods. Not everyone is appropriate. We want to take that into consideration. But also, one thing that provider has to do is to be able to document the initial assessment in addition to subsequent online interactions, okay? So there's documentation that needs to be in place when having that initial conversation with an individual to assess if they're appropriate to receive services through distance methods. And once again, that documentation is very, very important as it relates to future interactions as well. So it is always considered that when an individual is a likely candidate to receive distance services, that the provider always meets with them face-to-face first, okay? Because with that assessment piece, you want to determine, you want to make sure you're talking to who you're supposed to be talking to, and there are different identification issues that have to be taken into consideration, but also assessing which type of median is going to be the most appropriate, and also the location has to be discussed as well. So there are a couple of different components that need to be addressed when identifying and assessing if a person is actually a good fit for telebehavioral health services. Another role is by offering assistance with online self-help resources to make sure that those resources are available to people. As I mentioned earlier, some of those resources might actually be an addiction helpline, it might be the suicide prevention helpline, it could be the disaster distress helpline, just a number of different resources that can be offered and made available to individuals as well. So another thing we have to look at is assessing where and when services should and should not be done, okay? It's very interesting because people who are receiving telebehavioral health services are not always cognizant of the different technological issues that go on, the HIPAA issues that go on, and the importance of protecting privacy and confidentiality. Anywhere that does not allow for privacy has to be taken into consideration. It's always suggested and recommended not to use any type of unsecured networks or devices, or anywhere where the individual cannot immediately access emergency services if needed. Okay, so those are things that the provider actually has to be very conscientious of. So as we kind of begin to narrow this down a little bit further, so we want to look at some of the different benefits of telebehavioral health. And so one thing that's important to keep in mind is that every patient or client, they should have an option. They have the option and the right to see a provider in person or through distance methods. And that is something that they have to choose after they have been given all the information, the pros, the cons, the challenges, the barriers, but also the benefits to receiving services through telebehavioral health means. So we want to make sure that people know that they do have a right to choose. In providing telebehavioral health services, one thing that has been identified is that most individuals have found that technology has been non-disruptive in the process, and it was not significantly different than the traditional face-to-face visits that occurred within the clinical setting. We found that patients and clients did not necessarily view telemedicine or telebehavioral health as negatively impacting the therapeutic relationship. And that's something that's very important, because some people might view the distance service delivery as having an effect on being able to build rapport and having a good therapeutic encounter. But we have found that it has improved access to substance abuse as well as mental health treatment services. So, once again, a little bit more about the role of the telebehavioral health provider. So, one way we wanted to kind of just share this piece is by talking a little bit about what's not appropriate and what's typically discouraged. So the question comes up in our current climate and atmosphere around social media. The use of social media for telebehavioral health services is discouraged, okay? But also the use of avatar programs, which is discouraged, and automated programs as well. So when we look at social media, avatar, as well as automated programs, they're intentionally not encouraged due to the lack of privacy around the information using online methods, okay? So the question has come up, you know, what if we come across a social media app where we can kind of do therapy with different people? Well, that's not really, it's not really encouraged because of the different challenges that go along with it. In addition to that, it limits the capacity to actually lay the eyes on the person first prior to delivering services exclusively through distance methods. So we're going to start wrapping up, and wanted to just share some of the different references and resources that have been used. This is available to you. There's always training, additional, more in-depth training available for telebehavioral health services, and want to encourage you to access those resources if you are interested in receiving additional information. But this was intended to kind of give everyone a brief overview as to what the program is all about, but also encourage you to self-assess if this is something that you're interested in, if it's something that you feel like you're capable of doing, but also considerations for the agency as well. Is it a fit, and is this something that can be done within your respective agency? So in looking at training and technical assistance, MAO does offer through the Telehealth Resource Center different types of trainings as well as support for planning and implementation, on-site or video conference trainings, which are also made available, but also the development and utilization of how-to guides for telehealth equipment, as well as some of the different peripherals that we showed you earlier. We also have videos available on how to utilize different types of equipment, best practices for utilizing the equipment, as well as how to measure the audio quality, which we talked a little bit about as it relates to broadband as well. There are provider certifications that are available. Most licensed disciplines can actually receive certifications to provide teleservices. I know through the National Board of Certified Counselors Center for Credentialing Education, licensed therapists can become board certified telebehavioral health providers, okay? And several other disciplines provide similar certifications as well. So, wrapping up and looking at other TA services that are offered, we also look at network topography and design. equipment installation and implementation, just the importance of knowing how to utilize what you've purchased and install it as well, but also troubleshooting and problem resolution for equipment and the different types of peripherals, especially as it relates to connectivity, but also providing on-site and remote assistance which is available as well. So this has just been a general overview of telebehavioral health. We wanted to make sure that everyone is familiar with just some of the terminology that is associated in the telebehavioral health culture, distinguishing between medians as well as modalities, but also thinking about all of the different considerations when putting together a telebehavioral health program. So we talked a little bit about administrative considerations, programmatic considerations, provider considerations, but also, most importantly, the technology considerations as well. So if you are interested and just kind of want to talk more and keep the conversation going and learn a little bit more about the telebehavioral health component and what is involved, I've listed a couple of resources here, which consists of our program manager that manages the Telehealth Resource Center and makes sure that everything is connected and we're compliant with the law, but also our support specialist that assists with different aspects administratively, programmatically, and technologically as well. And then as a clinical provider, I can provide information on the clinical component as well. So I want to turn this back over to Brandon to see if we have any questions or comments.
I do not see that we have any questions at the moment. No, no questions.
Okay.
Thank you. All right. Well, thank you again,
Thank you for
Elena,
having
joining
me.
us. It's been a pleasure. That concludes our program for today. I want to thank Elena again for being here, and thank you for watching. Please remember that you can refer back to the training and resources anytime on demand. Have a great day.